Temporal arteritis is also known as giant cell arteritis. Temporal arteries involved jaw claudication, eyesight, headache problems, jaw pain, chewing pain, visual loss, and clinical features are temporal artery tenderness will be there, raised ESR and C-reactive protein, and there is high risk of irreversible blindness. So another one is Graves' disease. Graves' disease is a condition when there is increased level of T3 T4 in the body, weight loss, palpitation, anxiety, menstrual irregularities with diffuse goiter is there, exophthalmos because of increased thyroid hormones, peripheral myxedema, periorbital myxedema, and tremors will be there in this condition. Another one is multiple myeloma. It is autoimmune. Bone pain will be there, recurrent infections with fatigue. Now anemia, hypercalcemia, renal dysfunction, lytic bony lesions, and M protein spikes will be increased in electrophoresis. Next one is von Hippel-Lindau disorder. It is his family history is positive, CNS symptoms and visual problems will be there. Hyper Hemangioblastoma or brain spinal cord tumors will be there. Retinal angiomata, renal cell carcinoma, and pheochromocytoma will be there in this condition. So in this way, this condition is present. Rheumatoid arthritis patient having rheumatoid arthritis having morning stiffness more than 30 minutes and joint swelling with MCP and PIP wrist joints will be involved in rheumatoid arthritis. Now this condition is autoimmune wear and tear of synovial chondrocytes and then joint involvement, joint tenderness, deformity, and ulnar deviation, Schwann neck deformity will be there. RF positive rheumatoid factor and anti-CCP will be positive in this condition. Acute pancreatitis, inflammation of pancreas, epigastric pain radiating toward the back, and because of alcohol and gallstone is there, raised serum lipase and amylase level will be there, abdominal tenderness, and there will be Cullen sign or greater sign positive in severe cases. So hydrocele is painless scrotal swelling, increase in the size during day. Clinical features are trans elimination test positive, non-tender, and fluctuation will be there in this hydrocele condition. Wernicke's encephalopathy, chronic alcohol use or poor nutrition leads to confusion, ataxia, ophthalmoplegia, triad, and thiamine is responsive in this Wernicke's encephalopathy. Now, primary biliary cholangitis. It occurs in middle-aged women having fatigue, pruritus, dry eye. AMA is positive, and it is important point. Xanthellema, ALPC, LFT will be there. Increased in hyperlipidemia will be there because of fatty women. It condition happens. Sjogren syndrome. It is dry mouth, glittery eyes, dental decay, fatigue, positive shimmer taste with anti-ROLA antibody positive, parotid gland enlargement, increased lymphoma risk will be there because of dryness, dehydration. So this is Sjogren syndrome. Ventricular tachycardia, it is a condition. Ventricular tachycardia is a condition in which there is palpitation, syncope, chest pain will be there because of tachycardia. There is wide QRS, complex tachycardia, heavy dissociation will be there, and risk of sudden death can be there in the ventricular tachycardia. And the next one is Alzheimer's disease, progressive memory loss, disorientation, poor executive function, hippocampal atrophy on MRI, and there is motor function will be lost. So in this way, Alzheimer's disease patient present